everyone. I'm Dr. Qureshi, Fatima Qureshi. We have our patient with us. He's 25 years old, young male, and he has had a history of keratoconus. A lot of audiences wanted me, or patients wanted me to post a little video on keratoconus. So tell us, how long have you had keratoconus for?
I've had keratoconus for a little over a year now.
Okay, so keratoconus is a shape of the cornea, keratoconus, which means cornea is cone shaped. Normally the cornea is spherical, like this. You see that? It's a perfect sphere, round. But in keratoconus, it's not round, it's a little bit like this, like a cone shape, right? So when we check this cornea on this machine here, the slit lamp, I can see the difference. The right eye keratoconus is getting a little bit worse than the left eye, and because of that, his vision in the right eye is getting also a little bit worse than the left eye. So now we're going to show you a little image here, which is on our pentacam. So if you look at this part only, if you can focus here, you see this is the pentacam, and here is the central part of the cornea, which is red. So I'm going to make it a little bit bigger. Perfect. So here's the numbers for all the thickness of the cornea. If the central part is red, that means that's the steepening of the cornea because of the cone shape. And if you go, yeah, just keep it right there. Perfect. I'm going to show and compare the left eye. Look at that. Beautiful, right? So if you look at the left eye, this is the cornea. And this is not red. So you can see the colors, right? So this is not as bad, it's flatter, but the right eye definitely is the steeper cornea. The red part indicates that. So for the keratoconus, the patient was asking me, a lot of young people get keratoconus more so. At the time, I was telling him at the time of puberty, when they start rubbing their eyes more, so it makes it worse. So there is a correlation with that. If it's getting really bad, then I see other signs, which I didn't see in your case. Yours is still in the milder stage, okay? But I can see pigmentation on the cornea. There's another Munson sign where it's inferior part of the cornea is bulging out, but in his case, it's not looking that bad. I just saw the steepening, and I saw the cone-shaped cornea. So the patient wanted to know, like other patients, can I get some surgical treatment for that? Well, before the surgical treatment, we do recommend glasses. We sometimes recommend contacts and RGPs, which are the gas-permeable contact lenses. But if nothing is improving and if the symptoms are getting worse, then there is a surgery which is known as cross-linking surgery for the cornea, okay? And that is recommended. It's a very, very beautiful procedure, very effective, and therefore I'm going to refer you out for that. And we can get the consultation for that.
Okay.
Okay?
So what are the steps in the corneal cross-link?
Okay, so that's a great question. We don't do it in our office, but that's a very good question. So it's a machine where he has to lay down, and it's about 30 minutes process, but the surgeon takes about maybe like 5 minutes or maybe 5 to 7 minutes. There's an ultraviolet light involved in that, riboflavin is involved in that also, and that will conclude the corneal cross-linking.
Okay.
Okay, very good. I'll see you guys later. Bye.